The next two questions are related. So some newborns that have been diagnosed with hydrocephalus are not being shunted immediately. Under what circumstances might there be a delay in shunting? And would there be situations where enlarged ventricles may be monitored, then referred to a neurosurgeon? So this generally gets to the question of about thresholds for treatment. And there isn't a clear answer to this, right? This is some of it is objective, but a lot of it is subjective. And I think there's common agreement that when somebody's obviously very sick and demonstrating severe signs and symptoms of raised intracranial pressure with vomiting and irritability and lethargy, papilledema, critical changes in vital signs, I think nobody's going to argue that that person, that child, that infant, that adult needs treatment immediately. But beyond that, there's a lot of things that we consider. You know, things like in infants, the rate of increase in the head circumference, not just the absolute size of the ventricles, but what is the rate of change of the ventricles. In babies, we feel the fontanelle, how full is it? And you can get difference of opinions in that too, and that changes in a child, you know, minute by minute as well. Whether there's sort of splaying of the sutures, so the skull bones moving apart, and headaches. I mean, all these things are things we look for, but I can't give you an exact recipe for to tell you a priori if you meet this, this, and this, you're going to get treatment. If you're not, if you don't, then you're not. There's some idiosyncrasy to how we make these decisions, but those are sort of the general guidelines that I would use. And Andy, any comments on your end from that? Yeah.
Well, obviously we don't see kids with expanding heads in adulthood, but we do see the phenomenon of incidentally diagnosed hydrocephalus. There are adults who may in fact have large heads, and which implies, and they have big ventricles, which would imply that they had hydrocephalus when they were infants and simply carried on into adulthood, either because they had no symptoms or they had minimal symptoms. And I'm not infrequently referred individuals who have come to the emergency department having had a minor head injury or some incidental condition or a bad migraine they get a scan that shows enormous ventricles and they're sent my way. And we've had this concept that's persisted in neurosurgical literature of arrested hydrocephalus or compensated hydrocephalus. The idea being that, you know, if your ventricles get to a certain size and yet you're not developing symptoms, that your brain must have got used to this, and therefore you don't need to worry about it ever again. There has been a bit of change in this concept over time, because we do at the far end of the spectrum, when I talked about normal pressure hydrocephalus, we will also see older individuals present with this triad of hydrocephalus with the gait problems, the urinary problems, and the cognitive problems in the setting of a big head and clearly hydrocephalus that has been there for their entire life. So it's unclear whether individuals like this are at risk of developing further problems as they get older, and that's something we simply don't know about. So what we've tended to institute now is when somebody's sent to me with this, we do some baseline testing, and we're entering them all into a registry where we are retesting them every 5 years or so to see whether there are subtle cognitive changes as time goes on, which may make us a little more proactive in treating the hydrocephalus prior to becoming symptomatic. But there's no question, individuals with large ventricles can live out in their entire life and be completely normal.